See, any kind of drop in myomitis don't work much because you see, remember there are 15, 20 glands like this. So how will drop go inside the gland and do it? Mechanically not possible. So what I advocate is, यहाँ से पकड़ के have an ointment, you have to do lid margin scrubs. Then only some antibiotic will go. No drops will go inside. Ointment. You know, you said drops. Ointment is good. Ointment is perfect. But drops, though, you see how much is retention, how much is going to NLD, how much is coming out. So, wo nahi hai. It's the ointment which will you have to scrub amongst the gland opening. Then only it will potentially go. And you can, couple it with some kind of fermentation so that it becomes thinner. So, let's have Madhu, who is a prolific anterior segment surgeon. I have visited his place, does an excellent job in Vishakhapatnam. And he will tell us about this fashion of fashion. This is a fashion. You see, everybody in this country has NSA drops and lubricant drops because this helps pharma companies, everything. Because everybody has Nepafenac, everybody has Bromfenac or lubricants. So he will tell us where we should use a Nepafenac in these patients.
Yeah. Very good morning to all of you. Firstly, I thank Lalit sir for making me part of this presentation and also JB Pharma. And I acknowledge that the slides provided by the JB Pharma medical team. So I'll just try to share the studies that they have shown why we should use NSAID, especially Nepafenac post-op. And in the ending, I'll also be sharing what the practices that we follow in our place. If you see, overall, nearly 15% of the cataract surgery prevalence that we see in today's scenario, and that keeps increasing year by year. So what inflammation can cause is postoperative pain and photophobia. If untreated, can lead to several complications. So management of post-cataract surgical complication, if you see corticosteroids act at the level of blocking the arachnoidic acid release by inhibiting the phospholipidase, whereas NSAIDs inhibit prostaglandin release by blocking the coenzyme that convert the arachnoidic acid to prostaglandins. So these are two levels in which steroids and NSAIDs act to control inflammation. So corticosteroids, as already Kamal sir has pointed out, is a gold standard to treat ocular inflammation. However, they come with their own set of complications. So it's not that we are going to vote for either one of them, but how do we combine them and use it judicially for better outcomes? So how do we reduce the use of prolonged steroids is NSAIDs can be a safe alternative to corticosteroids, not immediate post-op, but maybe as we progress in the post-operative period, as you taper the steroids, there can be a role of NSAIDs. They're widely used to manage inflammation, CME, and post-op pain. They provide surgical outcomes in routine and complex cases also. So for pain and inflammation management post-cataract surgery, the indication is Nepafenac. It penetrates the cornea and then forms into the Amphenac thing, that is the main molecule that acts in the corneal level. So why Nepafenac? Nepafenac was among the first prodrug that was produced, and it is not like a free acid like any other topical NSAID. Other ophthalmic NSAIDs, due to their water solubility, have limited corneal epithelial penetration when compared to Nepafenac. So Nepafenac, 0.1% for prevention of ocular inflammation associated with cataract surgery. So here is a study, and there they have seen 487 patients where you have a placebo and Nepafenac. And if you see at the end of 14 days, definitely patients were more pain-free when compared to the placebo that you can see in the second week visit. Next is perioperative administration of Nepafenac. This I'm not sure, I don't use this perioperatively, but there are also some studies that 73 cases where they have felt that it has a better reducing inflammation in the post-operative period. Again, there's one more study doing the same thing. So when you compare the visual acuity score and also the thing, 1% has a better patient comfort. So next, coming to Nepafenac steroid combination, whether you want to combine it with dexamethasone or prednisolone. So if you see NSAID combination along with the dexamethasone gives you a lower incidence of CME, and they're more favorable flare values when compared to steroid alone. So again, here you have 160 patients where the total macular volume or proportion of the patients of macular swelling is less in the combination group when compared to the single treatment with dexamethasone alone. So this is the dexamethasone combination. Next you have the prednisolone combination also, where they have seen in 140 patients, and here again, if you can see by group 2, they have a marginal better post-operative iris control when compared to the single use of thing. So the key takeaway is Nepafenac, an anaeosed drug, is readily absorbed across the cornea at higher pH levels also. It contains BAC, so BAC is not a bad thing. BAC itself is actually an anti-fungal, and in short-term usage, it doesn't cause much harm to the ocular surface. Nepafenac 1% effectively prevents post-cataract surgery inflammation, pain, and higher cure rate, with patients being more pain-free. Preoperative Nepafenac significantly reduces inflammation in every post-operative period. And a combination of Nepafenac with dexamethasone reduces subclinical macular swelling inflammation along with subjective complaints. And the addition of 1.1% to corticosteroid significantly reduces inflammation when compared to prednisolone alone after phacoemulsification. So in our practice, what we do is we usually start off with an antibiotic steroid combination. For the first week, we don't give any Nepafenac. As we start reducing the frequency of steroids, that is when we introduce the Nepafenac and give it for a period of 3 to 4 weeks, because the steroid effect starts coming down. And routinely we give it in diabetics patients, but in other patients it's up to you to take a call whether you want to use Nepafenac routinely or not. So that is my practical take on Nepafenac. Thank you. Sir, 3 times till the bottle is over.
The bottle,
Yes,
bottle का मतलब नहीं है, bottle तो we will not talk about bottles here, but no, that is post. Yeah, no. Jokes apart, you see, post-operatively, I think most of us agree. But जल्दी करके चले जाओ.
Again, for compliance sake, sir, first 1 week I give only.
Post-operatively, we agree that in the initial week or 10 days, which Kamal also said that 7-10 days, it makes sense for compliance issues, that anti-steroid combination.
Yeah.
After that, there is no role of antibiotics at all. You should shift to either steroid or add
And steroid
Nepafenac.
also, now we have better steroids like 1%
So I'm actually, Madhu, more
can.
concerned about pre-operatively. Pre-operatively use of Nepafenac, which I was looking
Maybe
for.
like uveitic eyes and all, they may have a role, sir. Otherwise, pre-operatively,
Correct.
I don't.
So we should distinguish. One is a uncompleted surgery.
Correct.
Other is a completed surgery. In uncompleted surgery, what should we be doing? Because most of the patients, what all of us operate, 90-95% will go routinely.
Yes.
But it is those select 3
Select
to 4%
cases
patients where you will be required. So what I have in my this thing is a fellow eye who has developed a CME in the previously.
Yes.
Then diabetic patients, they're more
Diabetic
prone.
anyway.
Uveitis patients are more prone.
Yes.
So these patients, you should be slightly more careful.
Okay.
So this is one
even
message.
pre-op, sir, you are suggesting pre-op?
Pre-op, yeah. So these patients, you should be slightly more careful.
Yes.
And you showed that cascade pathway, where steroids act upper end, then COX inhibitors come low down. So why the lower preference rather than the higher drug, steroids?
Yeah, steroid.
I know there are people in Germany and people in other, 1 or 2 more countries where we had webinars. They do not use post-op steroids at all in an uncompleted situation. So what the gentleman dialogue said, one drug once a day, like Nepa once a day is available, Brom also once a day is available. OD once a day, good enough. Nothing else is required. He does not give steroids at all.
Subconjunctival will be
nothing. No, subconjunctival तो वैसे ही खत्म हो गया. Subconjunctival we also don't give.
No, sir. If they are not giving post-op, probably they are giving something.
Honestly speaking, in a cataract surgery is dead actually from my this thing, because I do not see anybody giving subconjunctival at all. You see, we as retina surgeons, we still give, but as a cataract surgeon, I don't think so.
No, not in regular cases, sir. In those cases, they are not using post-op topical steroids. Whether they are giving subconjunctival.
Injection.
Yeah.
Yes. Huh? No. I think say overkill, unnecessary. That is for your satisfaction, for benefit of patient, तो नहीं है.
Nepafenac. Okay. All cases.
That's what I attended one webinar where I think this point was raised, and I was amazed that they do not use steroid at all. They just give Bromfenac or Nepafenac or lubricant. That's all. So I think we will
Yes.
go on to the third presentation also.
Thank